welcome back to the Nigeria in Focus show, a show where we get to discuss critical issues affecting the nation. My name is Bukola Adimula, and it's a pleasure to be your host again for today's episode. Our topic for this episode is healthcare financing. In this episode, we will be discussing the issue of healthcare with a special focus on the Sugar-Sweetened Beverage Tax. We look at the challenges that this sector faces when it comes to funding and possible solutions so as to provide quality healthcare for every Nigerian. With me today are two experts in this field who are going to share light and take us on the journey of healthcare funding, especially in Nigeria. Before we dive straight into the conversation, I will give my guests the opportunity to introduce themselves.
Thank you so much, Bukola, for having me. My name is Thelma Chioma Thomas Abeku. I am the Communications Coordinator at Nigeria Health Watch. Nigeria Health Watch is a not-for-profit health advocacy and communication organization. We are based here in Abuja, and part of what we do is we seek to advocate for better and quality health for all Nigerians. We work actively to engage and support the government to advocate for topical health issues in Nigeria. And one other thing that we do is to push for active citizenship for health, where we encourage Nigerians to demand for health and encourage them to get involved in issues that affect their health. And I'm really, really pleased to be here.
Thank you so much for joining us, Tema.
Thank you so much. My name is Gloria Chinyere Okwu. I am the program coordinator for Project Spring Blue. Project Spring Blue Health and Psychological Trust Center is a not-for-profit organization based in Abuja, from where we operate to all parts of Nigeria and even beyond. And we're a patient-focused organization. And what we do basically is cancer advocacy. We do a lot around advocacy. We engage with different stakeholders on issues that concern cancer patients in Nigeria. We do fundraising for patients. We do a lot of patient navigation. We train oncologists, all oncology professionals. We train them to provide better healthcare for patients. We provide free screenings. We also do research, a lot of research, and we provide psychological support to cancer patients. So everything we do at Project Spring Blue is focused on the patients, and we are also a member of the National Action on Sugar Reduction Coalition, and I'm happy to be here.
Thank you so much for joining us. I don't know, I don't want to use the word health expert, well, healthcare expert, because I don't know, maybe that term is like used for doctors or medical practitioners, I don't know. But I think the two guests I'm having today are people that are vast when it comes to policy and the healthcare. So, I mean, it will be an interesting conversation. Starting with you, Tema, can you just take us through the overview of the state of healthcare currently in Nigeria?
Okay, so by that you mean healthcare financing?
And healthcare financing.
Okay, so interestingly, the healthcare financing in Nigeria, it's been on a trajectory of a lot of components that has happened down the line. So, but I'll just start by saying some of the sources of healthcare financing in Nigeria. We have the budgetary allocation to the Federal Ministry of Health, where every year the government budgets a certain amount for health in Nigeria. We also have out-of-pocket payments. So when ordinary Nigerians who are not covered under the health insurance, they are sick, they go to the hospital and they pay from their pockets. So that's another source of healthcare financing in Nigeria. Then we also have health insurance. You know, some people are covered under health insurance, like some public servants, other organized organizations have also that opportunity that they cover their staff, people working under that organization in healthcare, under health insurance. And we have the National Health Insurance that also, under that National Health Insurance, we have the Vulnerable Group Fund. And that Vulnerable Group Fund is going to cover 83 million vulnerable Nigerians, that is those who are not able to afford healthcare. But the thing is, one thing we need to also think about when we're saying we want to cover a particular number of Nigerians who are not able to access healthcare or cannot pay for healthcare, how are we going to fund covering those people. So these are some of the sources of funding. We also have donor fundings where some international NGOs have come into the country to contribute to healthcare through certain interventions that they are carrying out in the country. So these are some of the areas that we fund the healthcare in Nigeria. But for getting Nigerians to enjoy healthcare, it's a collective effort, and I know that government is doing all they can, and also part of what we're doing as coalition members to ensure that more Nigerians can have access to care.
Thank you so much. I mean, I like that last statement you made. It's a collective effort. It's not just a one-man effort. It's not just for the government alone. Because sincerely, when COVID or Ebola came into the nation, it was not stigmatizing. It was not picking the people that it is going to affect. It affected literally everybody. It was irrespective of no man or no man's title. So I mean, it's a collective effort. Coming back to you, Gloria, the sugar, what led to the implementation, or should I say to the policy of the Sugar-Sweetened Beverage Tax, and how do you think this can, contribute to healthcare funding?
Okay, thank you very much. Sugar-Sweetened Beverage Tax is very important because Nigeria has a health emergency, and this health emergency is focused primarily on the NCDs, non-communicable diseases. Nearly 1 in 3 deaths in Nigeria is caused by a non-communicable disease. And when I say non-communicable disease, of course, we know diabetes, cancer, hypertension, and all whatnot. And WHO has come out to say that most of these diseases are triggered by excess consumption of sugar-sweetened beverages. And Nigeria has a very high burden of NCDs, especially type 2 diabetes. In fact, 1 in every 17 Nigerians, is about 11.7 million people live with diabetes. And that calls for action. And when you look at Nigeria as a country, just like Thelma mentioned, you realize that the healthcare funding, the streams are there, but how is the funding channeled? We have less than 6% allocated to health. We have less than 5% of Nigerians covered under the National Health Insurance Agency. So about 75% of Nigerians pay out of pocket. So, and this is a country that has been said to be, have a lot of very poor people. So how can we keep financing healthcare, in this manner when we can prevent some of these diseases? That is what gave birth to some of these pro-health taxes, which SSB is part of it. So we have to start looking at how to protect our people, how to protect ourselves from these diseases. Of course, we all know the age-long saying that prevention is cheaper and better than cure. So by cutting down on SSB consumption, which has been proven to have no significant value added to people's lives, but can cause a plethora of problems. So this tax is primarily to reduce, to increase the prices and reduce the demand. And of course, when the demand goes down, consumption also goes down. When the consumption goes down, we're likely to reduce the incidences of NCDs, especially type 2 diabetes.
Wow, thank you so much. I have a follow-up question to that, but I'm going to come back to you, Gloria. Let me go to Thelma. Gloria have taken us through an extensive story about how the policy was developed and what it's meant to cater for. We're Nigerian, and to an extent, we pay tax. And Nigerians, we feel as if the tax is not even being used. So how do you think how sustainable is the implementation of this SSB tax, knowing the story already around Nigerian government and using of tax? Do you think it will really, to an extent, it might not generate all the funding necessary, but do you think it can generate a relevant amount to fund the healthcare?
Okay, so what we are advocating for is for this SSB tax to be used strictly to treat NCDs, so non-communicable diseases. That's what we're advocating for. like I mentioned when I was talking about the different streams of funding for the health sector, we have other funding streams for the health sector. But we are saying this tax should be dedicated to NCDs. And why are we saying that? Most of this, from what Gloria said, WHO has established that one of the causative issues about all these diabetes are from sweetened beverages. So we're saying when we tax these commodities, let's pull back those funds into caring for people who may unfortunately have these diseases. Do you understand? So that's just what we are talking about. Pulling back these funds into for the care scheme for these patients. But I know the fear for most Nigerians. We have been paying tax. Where is taxpayers' money going to, and all of that? But we cannot say that because something is not working, we should give up. Yeah. So we keep trying until we get it right. And I must say that SSB tax is not something that is new to Nigeria. There are a lot of countries who are going in that direction, and they are using it to fund their healthcare system. For example, I don't even want to go to Europe because I know that UK is doing SSB tax. They are doing it already, and there is evidence that it's working. But let's come back home. Let's come to Africa. We have other African countries too that are doing SSB tax. For example, South Africa, they are doing SSB tax in their country. And what have they seen? They noticed that 19% of urban people are no longer buying sweetened beverages, 19%. And they noticed that in 75% of obese people, that it is higher in those set of people. So we have to look at the gains of paying these taxes. So we must move away from just thinking tax to the health implication and what good it will do to the overall growth and improvement of our economy.
Thank you so much for that answer. I still have a follow-up question, but I will direct it first to Gloria before I come back to you. You've mentioned the implication of this taxation and why it's necessary, and the disease it means to prevent, the non-communicable disease.
Yeah.
And she mentioned also about people's choice. I just want to say that, don't you think that, as you said, 60% of youth of 60% of Nigerian youth are above their 20s. Their heart health, they should be able to know what and what not to take. I mean, a lot of us got to a certain age without the tax and decided to drop taking soda drinks. Do you think it's really necessary for the government to really create a balance and bring a policy? Don't you think to an extent the government is interfering in people's personal choice? I mean, the tax. Don't you think it's interfering? Is it possible? Because something about government, sometimes they don't even know when not to stretch their hands too much. So don't you think to an extent this taxation might be interfering? I mean, that is one of the concerns people have. It's their choice. In as much as we know that, okay, it's trying to prevent some disease and trying to reduce the consumption of these sugar drinks, which we know to an extent that they actually harm the body. But I mean, it's still a personal choice.
Yes, so we're not saying that people should not take SSBs. That is not our point of advocacy at all. We're only saying people should take it in moderation. And we also know that no matter what we do, some people cannot live without the SSBs. Even if you sell it for 1,000 naira per bottle, people are still going to buy. Some people are so addicted, they will buy it. But what we are trying to do is to influence them, is to persuade them, you understand, to think of their health. Now, why the government would get involved is that, like I said, the consequence of living with NCDs has a ripple effect. You know, so even the government is going to feel that effect. The health systems will be stretched, right? Your family is going to feel, the family is going to feel the cost. So it's not something that one person has and it just happens to this person and it ends there. The effect just goes round and round and affects every other person. So we're not taking away people's choice. We're only persuading them and trying to influence their behavior. Just like the tobacco taxes, you understand? Where even the packs of the cigarettes have been made unattractive. You understand? Even when people in many countries now, you can't buy cigarettes in sticks, you have to buy in packs just to discourage consumption. Why? We can't take it away from people, say don't smoke, don't drink this. We can't do that. That would be infringing on their rights. But you can influence the number they take. You can influence how much they take it for their own good. So that is why we have to, just like Thelma said, you have to push the narrative to people that this is for your good. Would you pay this tax or give up this soda? Or would you pay for life? I'm a cancer survivor. Cancer is an NCD. I know how much I've spent and still spending to stay alive. You understand? If it were possible for me to pay a couple of naira, for now it's 10 naira per liter. If I were asked to pay 10 naira per liter for life, I think I would pay that or give up that drink than the millions I've spent so far treating cancer and still treating it. So we have to push that narrative so that people understand why they have to stop. And besides, there are other choices. It's not like you're going to not take SSB and that is all. There are other healthier options that people can go for. There are fresh fruit juices. There is water.
A lot of us take that.
Yes, there is water, there is yogurt that is unsweetened. I take a lot of unsweetened yogurt. I take a lot of fresh fruit juices that people can take that will have health benefits for them. And if you can't afford this, you take water. Water is very healthy. Or you can prepare beverages in your home. We have kunu, we have zobo that you can prepare in your home and add fruits or nothing at all. I take kunu without sugar. So there are other healthier options that you can go for. So it's not, I would say if the government has said no more sodas, that means you're infringing on people's rights. But in this one, you still have an option. You can go ahead and keep taking, or you can stop, or you can minimize.
Thank you so much. Thank you so much for that. Awareness is important because I think even a lot of people understand the fact that it's awareness. We're not pushing and trying to control them. They are just trying to make you aware of the fact that these are the challenges that come with this particular SSB you are taking. I think it is very, very important. I mean, LD life it's very expensive if you do not have it. So it would be better for us to be aware of it. Coming back to you again, Gloria, can you highlight some approach in Nigeria healthcare financing that stand out in the global context?
So this is a personal observation. I don't think we've gotten to that point where we have any innovation, anything that stands out for me as a person, because the WHO recommendation is 20% tax on SSBs. We are still doing 10 naira per liter, which is about 6.7%. So we are still far from the threshold. We've not even gotten to the threshold. You understand? And the danger of not getting to this threshold is that the tax is so small that the industry can absorb it without letting it get to the final consumer. Because the goal is for the tax to get to the final consumer and limit consumption and demand. But by the time the tax is small, the industry absorbs it. So people keep buying at the rate they are buying because the price has not increased significantly. So it's a danger itself. So I've not seen us even, we've not even gotten to the threshold, to start making, impacts that will stand out or make us worthy of emulation as it is now. And the fact that this tax is also embedded in the Finance Act is another worry, because it makes it vulnerable to sudden changes or, because the Finance Act is, every year there's a new Finance Act. It could be the Finance Act this year, and then by next year, discover it's not there. So it puts a lot of pressure on us, advocating every year and waiting, with our fingers crossed that to come out in the Finance Act again. So that's another danger. And so, but if we have a policy, if we have a legal framework that just stamps it, and then we know that, this tax, 20% tax, there's a law backing it, then we can now sit down and smile because we have something backing this advocacy. So as it is now, we are still floating, we are still struggling. we've not gotten to that point where we begin to make impacts, but we are grateful to the government for even considering general parental tax. At least is a right step in the right direction. So from there, we keep advocating for more. Yeah, so for me, nothing stands as it. We've not even gotten there. We're just starting.
I mean, we'll get there one day.
Yeah, sure.
It's a baby step for Nigeria.
Yeah.
Okay, coming back to the term, how do you think the policymakers and the health professionals perceive this tax and the implication it will have on both public and the health care system in Nigeria?
The policymakers are really excited about this and they are hoping that it works. Like Gloria mentioned regarding the Health Care Act, we are just still floating. It's not yet a law. So we need a law that helps us understand when these monies come, how is it spent? How is it utilized? We don't have that lockdown yet, right? So we need that to happen. Then we also need a framework, because when you talk about healthcare, you also have to think about the subnational level. How are we carrying the subnational levels as part of this plan to ensure that every Nigerian, regardless of where you live, you can have access to care, and not just anyhow care, a quality care. So we are working as stakeholders, and like I mentioned earlier, it has to be something that we do as a team. We do it as a united front and ensure that we're able to provide quality care for all Nigerians.
Thank you so much for that. What do you think are the prospects for healthcare financing in Nigeria, especially knowing the challenge that the country is currently facing when it comes to financing healthcare?
Okay, I think Sama has mentioned a lot of it already. We have multiple streams that I think what we lack basically is we lack a lot of political will to do a lot of things in this country.
That's the key word. We lack it in this country.
Yes, we lack the political will, and that is why many years later after the Abuja Declaration, we still have health budgets less than 6%.
Less than 6%.
Less than 6%. And and sometimes you hear worrisome things like Ministry of Health not being able to utilize the entire budget. So it gets, when I get such things, it gets me worried.
Ministry of Health
Yes,
not or cannot.
Yes. In some instances, I've heard it. Ministry of Health, not being able to utilize the entire budget, and then you hear some parts of the ministry telling you we don't have budget allocations. So there's a lot of the things I don't understand about the budget and how it works, and why are we still below 6%? Why is it that some parts of the ministry is not funded? Some part of the NCD's departments tell that they don't have any funding. And why should monies be returned when we are saying it's not even enough?
There's a lot of things wrong with Nigerian healthcare currently.
So a whole lot is wrong with the Nigerian healthcare. A whole lot has to be put together. We have to have this political, we have to know, think, and understand that our country has to be healthy first. Health is so important as much as food. I think health and food should be the priority in this country. That's what I think as a person. And so we have to pay attention to our budgetary allocations. How do we fund our budget? How do we have enough money so that from these places we can build good primary health care centers, we can build quality cancer centers, we can build quality diabetic centers, we can have good health care for our people, first of all. And then we can also begin to look at how to incorporate it. It's a good thing that the National Health Insurance Authority is thinking of having a fund for vulnerable people. But what I would like is that a lot of people are pulled into the insurance scheme. More people, we mean more funds. We mean a larger pool of funds, so that we can have money for people to fund. The out-of-pocket expenditure is killing people. 75% of people pay out of pocket in a country that is has the highest number of poor people on earth. How can you sustain that? Why wouldn't there be high mortality rates? Why won't 1 in 3 people die of NCDs? You understand? So we have to think health coverage, universal health coverage, you have to think about it. You have to think of properly utilizing donor fundings that come in for health financing. We have these streams already, What you should be thinking is, how do we expand? How do we properly utilize? How do we structure it well? How do we bring in people that have the interest of Nigerians at heart to begin to earmark these funds and use them well? And then for this new stream of income, the SSB taxations, all the pro-health taxes like Telma mentioned, from the cigarettes, from the alcohol, how do we earmark them, and how do we ensure that when we earmark them, they're actually used for health financing? So we have prospects. Honestly, we have prospects in this country. I believe we have the money. I don't think we have money. We just don't have our priorities right.
True.
Yes. So we have prospects. We should just think right and do the right thing. And I tell you, our health sector will be, we experience a very good evolution.
Wow. Thank you so much for staying with us up to now. Thank you so much for that insightful point, Gloria. And thank you so much to our audience for staying with us up to now. We're almost rounding up the conversation. But before we go, I just have one last question for my guests, and then we'll be done with today's episode. Starting with you, Telma. You've said a whole lot, the challenges and the way forward. But particularly to the policymakers, to the government, what do you have to say today when it comes to healthcare financing? How do you think they can come in and better it? They kind of play an important role. They play an important role when it comes to healthcare financing. So from your angle, what do you think the government, the policymaker can do to make healthcare accessible for all Nigerians?
Thank you so much. Very important question. Healthcare being accessible to all starts with UHC. I know she mentioned that, but when we say UHC, it's Universal Health Coverage. Yesterday, incidentally, was UHC Day, right? It's time to act. We have talked a lot. People are still talking, but it's time to act. It's time to put words. It's time to match our words with action. And it begins with doing the basic things. Gloria mentioned that some people are returning money. When we're saying we can't even fund health sector, what does it take to be able to utilize those money? I'm not saying squander the money. Utilize them well. Let's start with capacity building, technical assistance. There are a lot of organizations that can help build the government agencies, their capacity to be able to do better with funding that they get. So we can start with little steps. The political will, I believe that the political will is there. If you listen to some of the message from the president and some of the teams that he has put in place, you can see that there is a lot of movement towards ensuring that the healthcare sector works. But then they can't work by standing alone. We need all these different agencies to come on board with the right technical expertise to ensure that monies given to them are well utilized and all of that. Then we also need human resource for health. Strengthening our human resource for health is very important. The Japa syndrome has really dealt with the Nigerian health sector. But we have young people, and we can leverage technology for training. We cannot rely on our traditional methods, and we need to think outside the box. So some of the things that we can do is to leverage these trainings, have digital training. People outside, we can leverage it. That's gaining their brain to ensure that Nigeria works. So these are the things we need to do, and we don't have all the time. So we need to hit the ground running. So I think that the federal government can lead on this. They can really, really lead on it, working with other stakeholders, like Nigeria Health Watch is available. We will put out the information there and ensure that Nigerians are up to speed with the information. But more importantly, I would still advocate that Nigeria must and should redirect every tax, sin tax, and all of these projects, alcohol, beverage, SSB tax, all of them should go into the health sector. That way we can at least say that we have some monies that we can coming from other streams of source and looking inward, because we are thinking of how to improve our healthcare. We must think creatively how we can get funding, and I think SSB tax is one way that we can push for more funding into the health sector. There are other ways, but I think we can start with this.
Thank you so much for that, for those points, Telma. And for you, Gloria, what do you think? What do you have to say to the policymaker and the government when it comes to healthcare financing in Nigeria?
Okay, I think there's almost nothing left to say. Delma has said it all. For me, I'm particularly worried about the Japa syndrome and the brain drain in the country and the consequences. So like I mentioned, if I remember I started my cancer journey in 2017, and I can tell you that most of the doctors I used to know in 2017 no longer in the country. And if the doctors are not even here to treat patients, how would they survive? You understand? We have to start thinking of retaining our, retaining our people, keeping back our assets. I would like to call them assets. You understand? Because even the opportunity cost of losing those people. So look at how education is highly subsidized in Nigeria, especially in the federal universities. How much do you pay to train a doctor? Outside the country, we know that people take loans to go to school. In Nigeria, we don't do that because health education is highly subsidized, especially in the federal universities. And then when the government finish training people at such low cost, and then people in the advanced countries just pack them. Let me use that word. They just move in droves and attract them, entice them, and take them out of the country. You understand? And they enjoy the benefits that we would have enjoyed. So the government have to start thinking of what it's losing in manpower and resources. So the Japa syndrome is a big deal. How do we keep our doctors back home to practice? How do we fund how do we build infrastructure? Our health infrastructure is decaying by the day. How do we build infrastructure? Like she said, how do we leverage on the expertise? So I think, yes, to an extent, I think the Bola Tinubu administration, has some nice teams, some experts, how do they work together collaboratively? You understand? Not some sector, not having funding, and then money is being returned. If there was collaboration, if people are working together, they would know what to do with the money, So there has to be a lot of working together, leverage on technology, again, like she said, and of course, focus on prevention. If we don't focus on prevention, and we put our health system in place with our massive population, and everybody is sick and going to the hospital, the system will still collapse. Because that's going to be a lot of people demanding healthcare at the same time. So we also have to think prevention. Any disease we can prevent, we should actively prevent it. Create awareness for the people, do as much as we can to make sure that we prevent the ones we can prevent. And even if it comes after all our efforts, it's fine. We can't prevent all, but I think prevention should be a primary focus for NCDs. A lot of NCDs can be prevented, and a lot of emphasis should be on prevention. And that is one thing the SSB tax can be used for prevention of NCDs.
Thank you so much. Thank you so much for your point, Gloria. And thank you so much to our online audience. I hope you enjoyed the conversation just as I did. I mean, my two guests, one thing they keep mentioning is that prevention is better than cure. Prevention is less expensive than curing a disease, especially in Nigeria, that we know that the health system already in Nigeria is not top-notch yet. So you will spend a lot if you want to cure a disease. Thank you all for staying with us up to now. To our guests, thank you so much, Tema. Thank you so much, Gloria. I had an amazing time with the two of you. And to our live guests, thank you all so much for staying with us up to now. Until next time, have a wonderful day.